Hello, good evening, everyone. Welcome to our 13th episode of the virtual Doctor's Night Out. Thank you for joining us, and I'd like to introduce Dr. Kellyann.
Hello, everyone. Good evening. Welcome to Doctor's Night Out. I'm Dr. Kellyann Petrucci, your host for this evening, and tonight we are having a COVID catch-up. This is the episode where we're going to get you caught up on all the latest. And what's so amazing about the doctors that you see on this panel, not only are they giving so graciously of their time when they are all working physicians, still seeing patients, many of whom are still seeing COVID patients, actually. They're taking their time out. And what's so amazing about them is they have, if you will, an East meets West type of philosophy, meaning that a lot of these physicians that you're hearing on the show, they're functional medicine doctors. So they look at things not only medically, but they look at all sides. They look at the body in a different way, and they treat the whole body, and they listen to symptomology in a different way. So what's so beautiful about having these discussions with these doctors is that you really do get a different inference from them. And I'm so proud and I'm so pleased to have them. The doctors on this program, they're doctors that I know, love, and trust. You can be assured of that. Many of whom I've broken bread with and had long, hearty discussions with, always leading me to say, wow, this person really has something to say. These are doctors that are completely committed to growth and integrity. These are your true truth seekers. Welcome, panel. So happy to have you this evening. And
Thanks for having us.
Hey, how these doctors are not just like falling over in exhaustion. You know, it's so funny because I talk to so many people and they're just kind of laying around right now. And the world is on a stop, and a lot of people are just on a stop. And we're not actually, we're like out there, and this is actually more exhausting for us than the other parts of our career or the other times in our career. I mean, how are you feeling? Tell me, just like, well, let's open this up. Dr. Pedre, how are you feeling? Are you working 24/7?
You know what? I'm feeling fired up, Kellyann. Good. And I'm going to make some noise for all those doctors out there that are working really hard.
That's everyone.
Thank you so much.
Applause. You know, we do this at 7 p.m. in Manhattan, and that's all over. Let's just say thank you so much to everyone out there who is getting it done for us. They're risking their lives. They're away from their families. So really, God bless them. God bless them. So
it just shows the resilience of people, going out, and in spite of what's going on, just cheering, clapping. I see people going out with pots and pans and banging on them. The other day there was a firework that went off in my neighborhood.
Nice.
And I think, we have to keep the spirit up.
The spirit of humanity.
This is a long haul.
The spirit of humanity is coming through again. So I just, I got Dr. Pedre's kind of a take on this. Dr. Moorcroft, tell everyone, how is this impacting you, your life? How are you managing everything that's happening right now? And are you working 24/7? What's your life like?
Yeah, I mean, it's actually, I've been telling people I am more socially engaged and during the social distancing and working more than I think I've ever worked in my life. And I just feel I'm fired up like Vincent. I'm just so thankful to have an opportunity to share in this really difficult time from my background, and being able to, cause I come out of emergency and critical care medicine and now specialize in infectious diseases. So it's nice to be able to share that ability to remain calm with people while sharing the facts so that they can figure out how to move forward. So it's been a busy time, but hanging in there, trying to keep my sleep up.
Yes, that's the thing. Dr. Cook, what about you? How are you managing life?
I'm doing great. I shut my clinic down for a little bit, but we're back to being open 5 days a week, full time.
When did that start, Dr. Cook? Was that recent?
Last week.
Yeah.
So last week I was probably 20% busy. This week I'm probably 50% busy, and then next week we're 100% busy. So.
Yep, back to it. Dr. Littleton, how are you managing life?
Managing very well. Seeing patients in the outpatient setting, seeing my concierge patients, also in the hospital. I have to say, across the board, census is down in hospitals somewhat because of the stay-at-home mandate. So people are actually staying at home. You know, a lot of us physicians are asking, where are some of those soft tissue infections? Where are the congestive heart failure exacerbations, COPD exacerbations? So in some hospitals, you know, they're seeing a third of the census. Hospitals have made room for COVID-19 patients. But for the most part, you know, people are staying at home. And so, you know, retrospectively, we'll have to look at, you know, is there a delay of care somewhere? Is someone in trouble that they need to be in the ER? But also with this is the rise of telemedicine. So I think that can also account for some of that. So this is a very interesting time that we'll learn from when we look back retrospectively.
Oh, it sure is. And let me just let everybody know that's watching why I'm so proud to have this panel on. Let's just read a little bit about these wonderful doctors. So Dr. Pedre is by the way, who is definitely, you know, beloved here, and, you know, the audience just embraces him. He's so full of knowledge and has been on countless times. Thank you so much, Dr. Pedre. We just love you. So
Always
Dr. Pedre.
thankful for being here.
Yeah, Dr. Pedre is the medical director of Pedre Integrative Health and president of Dr. Pedre Wellness. He's a board-certified internist in a private practice in New York City since 2004. His philosophy and practices are a blend of both Western and Eastern medical traditions. He's a clinical instructor in medicine at the Mount Sinai School of Medicine, as well as a certified yoga and medical acupuncturist. His unique combination of medicine is best described as integrative or defined by a functional systems-based approach to health. His most recent book is called Happy Gut, and you'll find out at the end of this hour why he is known as the gut doctor. He's incredible. So Dr. Jason Littleton, I always describe Dr. Littleton as the one that I end up having 4-hour lunches with in New York City. He's got such a great outlook on life and is such a wonderful father and husband to his beloved family. Dr. Jason Littleton is a board-certified family physician offering convenient concierge healthcare. He emphasizes personal attention, prevention, and smart lifestyle choices for optimal health, wellness, energy, youthfulness, longevity, balance, and happiness. He encourages patients to eat nutritiously and focuses on fitness, providing clear, practical, personalized guidance for doing well in our busy lives. And we really need that. So happy that you're here. So happy you're here.
Thank you for having me.
And so there's so much to say. I mean, he's just done so much. He's been featured on all kinds of shows. So Tom Moorcroft. Dr. Tom is a board-certified family medicine and osteopathic manipulative treatment with expertise in autoimmune disease. Dr. Moorcroft is a board-certified osteopathic physician who is a global leader in solving complex medical mysteries. He has over 2 decades of experience in the hospital and private practice, helping his patients regain their health. Dr. Tom's personal and professional medical philosophy focuses on optimizing the body's self-healing systems in order to achieve optimal health with simple natural interventions, utilizing more conventional approaches such as medicines when needed. And so Dr. Tom is a newer friend, but I can tell you I'm already crazy about him because to me, attitude is everything. It's everything. And your disposition and your attitude means so much. And he is such a bright light, so positive and so robustly enthusiastic about life. I'm so happy you're here, Dr. Tom.
Thanks, Kellyann.
Yep. Dr. Matt Cook. So Dr. Cook, I mean, I feel so blessed because you all are so smart, and Dr. Cook is so mission-based. The reason why I knew that Dr. Cook and I were going to work together a lot because he gets on the phone and I knew right away, purpose, mission, he was on it. He is truly here to serve the greater good. So happy you're here, Dr. Cook. He founded BioReset, a medical corporation, and acting president, operates an integrative medicine and pain medicine practice that offers leading-edge non-surgical solutions in orthopedic medicine, sports medicine, and regenerative pain medicine. Dr. Cook is a board-certified anesthesiologist with over 20 years of experience in medical practice. Currently, Dr. Cook is president of California Anesthesiology and medical director of the National Surgery Center in Los Gatos, California. Dr. Cook's early career as an anesthesiologist and medical director of an outpatient surgery center that specializes in sports medicine and orthopedic procedures provided invaluable training in the skills that are needed to become a leader in the emerging fields of musculoskeletal ultrasound, imaging, and nerve well, you can say that word, hydrodissection.
Hydrodissection. I learned how to do it as an anesthesiologist, but I have to tell you, I have to update my CV because that surgery center got shut down. Is over now. So.
Oh my gosh. Oh my gosh.
It's all good.
Well, anyway, we're so happy to have all of you here, and everyone here has such important information to offer. So we're kind of scripted on the show a little bit in that the doctors typically have a rough idea of what we're going to talk about, so we can really cut to the chase and give you on point information without wasting time. But, you know, as this news evolves every minute in this world of COVID, that there's always something new. So there's a couple of questions I just want to ask right off the top of the, off top of the hour, which is, we're finding now that the medicine that we talked about, I mean, Dr. Pedre, you and I had this discussion before it even came out as public knowledge. And then everyone was so excited about the prospects of hydroxychloroquine being so, such a golden piece of intel for us. Now we're finding that it's not what we thought. What's your knowledge on this?
Look, when we chose, and this was based on limited studies initially, and just looking at data on the mechanism of action of hydroxychloroquine in vitro studies, where it looked like it could have activity against, it was studied with the old SARS and now being studied with the COVID-19. But the thing is that patients who have been started, I can tell you from seeing my patients and just working with a patient who went to the hospital, patients are being started on hydroxychloroquine at many different stages into this illness. So the further, I think what we'll find if we actually did a study and we looked at this, is that if you're started on hydroxychloroquine after you've already got into the stage where you're hypoxic, your oxygen levels are dropping, that it's not going to be as effective as if you started it early on. Because when we were first talking about this, I had found a report from China that people who had lupus or rheumatoid arthritis who had been taking hydroxychloroquine chronically as an immune modulating drug were not getting sick with COVID-19. So I thought that was really interesting. And a lot of these studies have shown that if you pre-treat with the medication, it has a much more powerful blocking effect than if you're trying to kind of save the ship once it's already taking on water, right? So I think, when you hear reports like this, you have to wonder, and any doctor like me, functional medicine, like we're always trying to stay ahead of the game.
Yes.
So one frustration I met was that halfway through when I was seeing COVID cases here in New York, the governor put a law into effect that you could not prescribe hydroxychloroquine unless you had a positive diagnosis of COVID.
Too late.
So then that works against us as doctors using our best judgment, because I knew that this is the type of treatment that if you started earlier, it's going to be better. And another thing to note about hydroxychloroquine, which is the safer version of chloroquine, which is the one that a lot of people spoke about having heart problems.
Yeah.
Right.
Hydroxychloroquine has an extremely long half-life. I think the half-life is around 12 days. I'll have to correct myself later. But what that means is that it takes that many days for half of the drug that was absorbed to get out of your system. But what it also means is that it's going to take several half-lives for it to build up into its full maximum level in your tissues. So a drug with that half-life that you're starting when the ship is already taking on water, it's already too late. And I've seen reports from other doctors, pulmonologists saying they started knowing people have treated multiple COVID-19 patients that have been all through the spectrum, all the way to respiratory distress and hypoxia, that what they found is when you started the treatments earlier, and again, this is just clinical experience, but you know, the medicine was built on clinical experience before studies, that the earlier you start the patient on these medications, the more efficacious they are.
So
I think that's where
that's a system thing
to weed out here.
Yep. So yeah, it's when you're in the system, it gets difficult sometimes to process the patient and the way they need to be processed. So Dr. Tom, we were speaking earlier about the cats, and
Right.
now we're finding that they're testing positive, but this is supposed to be some kind of revelation of sorts. Where is the surprise?
Well, yeah, I think as we were talking earlier, I mean, we do know that coronaviruses are known to infect animals. In fact, I mean, this one probably came from bats. It's something like 96% genetically identical to a bat strain, and it crossed over to humans, most likely through another mammal. People think the pangolin. But, you know, I mean, I've been hearing for weeks. I mean, they had a bunch of big cats at the Bronx Zoo who were the first, you know, cats known to have it. And they had mild respiratory symptoms and improved. And I guess today they're reporting even more of the cats have been exposed. So I don't know that it's a big surprise. I guess the question that I have is, who's giving it to the cat? I mean, you know, we're trying to figure out, are we giving it over to the cat? Then can the cat give it back to us? Which I think is really the big unknown at the moment.
Yeah, with a lot of unknowns, I think that we keep trying to unravel. Dr. Littleton, you and I discussed, and you really have such a beautiful knowledge base on this testing. I mean, there's so much going on with testing. Every time I think I have a grasp of it, there's another spin. Where are we on tests, specifically the early antibody tests that people have been, you know, infected and without showing symptoms? There's just so much going on with this. Does this mean that we could have herd immunity sooner than we thought? So what's happening with all of that?
Well, you know, the herd immunity concept, you know, that's very interesting because, you know, that definitely is in play. You have asymptomatic people who may have had the virus and they don't know it, spreading the virus to higher risk populations who are symptomatic, okay? And what's going around is that once exposed, you know, IgM is the first antibody that pops up, and that can pop up somewhere between 3 to 7 days, where you have IgG, which is the late antibody that can pop up around 14 days. There's a range. And what we're looking at here is that those asymptomatic individuals may have antibodies, never knowing that they had the disease, okay? And so they develop a sort of immunity, and that's the herd immunity effect. Now, what's interesting is that people don't know, we don't know how much immunity this gives, okay? You know, is it something where we have to measure the titer? Is it something where we have to find out, will it only work for certain strains, not other strains? This is the big question. And now there are antibody tests that are coming out. None of them are FDA approved. But what we need to know is in terms to get people back to the workforce, who is immune, who's not, who's safe, who still needs to self-isolate. So this is the big, this is the hot topic right now. And so I definitely, herd immunity is at play, and we need more randomized control studies. We need more exploration here so we can understand this and get people safely back to work.
Is there ever going to be a scenario, Dr. Littleton, where, you know, we get shipped at home a little kit and, you know, we give it to administer it to ourselves and our family? Is that ever?
That's going on now. LabCorp actually, in the upcoming week is doing just that. But here's the thing, it's still regulated by a healthcare professional. So what's happening is that what's being shipped is the molecular test, not the antibody test, the molecular test, where what people are doing is they're taking a cotton swab, getting a sample from their nose, then mailing it to LabCorp, where it's being analyzed and interpreted by a lab technician and a doctor. So laymen are not interpreting these tests. And this is looking for viral RNA. This is not the antibody test. Again, antibody tests are not FDA approved. This test, though, is diagnostic because we're looking for viral RNA. But the key here is that if someone's had it before, like a month ago, it can show up negative. Whereas the antibody test will say, hey, they had it before, possibly. Possibly. I got to say possibly, because again, these aren't FDA approved and more exploration needs to be done here.
Kellyann, I would say there's a lot of problems with sending someone home a swab test, because those swabs, to get an accurate sample, are incredibly difficult to do and really uncomfortable, especially doing a nasal swab or even getting an appropriate throat swab. But I am aware, Dr. Littleton, of a company that's doing a finger stick for IgM and IgG. But again, these tests need to be validated. And I think that's the big question is how sensitive are they? And are you going to get false positive or false negatives with them?
And various labs have different sensitivities and specificities. And even my concierge practice, we're doing the antibody testing and we're doing the molecular testing. We do both. I do both because I need to know. And I'm really depending and hanging my head on the molecular testing, okay? And I've screened people and cleared people using the molecular test. And so I've gone through that process and, very carefully, because we want to be sure, we want to reduce liability, and we want to make sure that a person is safe to go back into the workplace or just be around their family.
And I think that's, Kellyann, I'm going to jump in just for a second. I think that's a really interesting question, because you can also do molecular testing on the stool, and they're finding that people will shed virus in the stool for, I've heard, up to 21 days after symptoms resolve. So you wonder, do we really know how long the infectivity period is?
So is it still possible, Dr. Cook, I want to float over to you for a moment. There's a couple questions I want to ask you. So is it possible that someone, again, that they're a silent carrier, right? Is that the big problem that we have, is that people actually are infected and they don't know and they're spreading it? And so that's where the testing has to come in, because we have this wide array of, people that have skin problems, people that have all kind of problems, as we know, it's in their chest. We have other people who have all kind of inflammatory issues. So what do we do about the people who are silent carriers? How do we manage that?
Well, we have to do testing to figure out who those people are. And the great thing about silent carriers is on the other side of that coin is herd immunity. And so eventually those silent carriers are going to build a group of people who are hopefully somewhat more resilient. And we need to do large scale testing. And so that's not going to happen tomorrow or in the next few weeks, but hopefully there's going to be, enough grassroots interest in that. And I think there's a lot of scientific interest that that's going to come.
Well, we've learned a lot of new words, Dr. Cook, during this whole experience, social distancing and flatten the curve. We've learned so many new words we've never heard of before. There's a word, though, that we don't know, and we talk about it a lot on the show, but I really think it should be a word that we use pretty regularly when we're speaking of this disease or this virus, and that is the cytokine storm. And you explain it as the good cop, bad cop. Can you explain this a little?
Yeah, my friend Richard Rossi, I told him about the cytokine storm, and he says, well, I don't know exactly what a cytokine storm is, but it doesn't sound good. And so I came up with this analogy, which is in buddy cop movies, a lot of times they play good cop, bad cop. And so one cop comes on and he's the bad cop and roughs somebody up, but then the good cop comes in. And then Mark Wahlberg and Will Ferrell had this movie called The Other Guys. And one guy was the bad cop, and then the next guy came in and was even a worse bad cop. And our immune system is whenever there's a problem, the first thing that it does is it sort of drives an inflammatory response, which is kind of bad cop. But then another part of the immune system comes in and calms that down. So we're constantly turning up something that's bad, but then healing it. And so we don't have a long-term consequence of that. What happens with this virus is that the virus infects cells in the lung, and then it goes into the cells and takes over their machinery and duplicates itself, kills the cell, and then a whole bunch more virus comes out into the airway. And so we can get an overwhelming immune response, which is a bad cop response, where the immune system, the inflammation becomes kind of a runaway form of inflammation. And then when that happens, it goes from being just into the lungs into the bloodstream. And then, and it turns out it just acts on this one little receptor that sticks out of cells. If it gets into the bloodstream, then it goes everywhere where the blood goes. And it turns out that receptor exists in the heart, it exists in the kidney. And so as a result, people can have effects all over the body and all kinds of organs when the horses, quote unquote, get out of the barn.
So another word that we don't hear much about, Dr. Moorcroft, is ACE2 receptors. And you think that they're important in the whole picture of infection and what's really going on with this. Can you talk a little bit about that?
Yeah, I mean, and I think it's a great segue from what Dr. Cook was saying, because that's the receptor that he's referring to. And so I think a lot of us have seen the COVID-19, sort of the SARS-CoV-2 virus with the little spike protein. And so that protein essentially docks on this, ACE2 receptor in the lung. And then it gets in, like Dr. Matt was saying, and sort of hijacks the cell's machinery. And what's really interesting is there's this conversation when COVID-19 first came out that, oh, when we have medications that increase ACE2 levels, we have worse outcomes potentially. And then there's this discussion whether we should avoid medicines or change them. But as we look at it more, what we're finding is that the people who are most hard hit by COVID-19, they have advanced age or they have pre-existing conditions like heart disease or diabetes. These are, or even kidney disease, these are conditions that are actually associated with lower ACE2 levels. And we see people like children and young adults who naturally have higher ACE2 levels actually doing a bit better as a general rule. And to kind of like what Dr. Pedre was saying, we need broader, I think we've all said this, we need broader testing because we don't know who's actually sick. We've actually been looking at who's been most sick and who presents, and that's where we've been using the molecular testing, because a lot of people initially were turned away. And so what we're thinking is happening here as this goes on further is we're missing a lot of the young people, and so we're not counting them in this whole pie. But because there's a question, if you have a higher ACE2 level, will you actually be more likely to get COVID-19? And that's possible. But what we're seeing is that the lower ACE2 levels in these chronically ill people tend to lead to exaggerated inflammatory responses. And people have actually talked about ACE2 exhaustion, meaning, we sort of use up our receptors, and as like Matt was saying, you get, as these more viruses come out, you're actually having more and more try to get back in, and we're burning everything up. So then we have all the white cells accumulating and increased vascular permeability. We get fluid in the lungs,
yes,
breathing problems, etc. So I think that with the ACE2, it's not so, the picture is unclear at the moment, but I'm recommending that all my patients actually do their best to boost up their ACE2 levels naturally. And the beauty of all that is, if you do regular aerobic exercise and eat a plant-based whole food diet, that's two of the best things you can do to actually boost up ACE2 levels. And if you like cooking a lot like my family does, you can add things like turmeric, rosemary, oregano into your foods and actually boost them up. Because there's actually studies showing that if you give ACE2 in people who have lung disease, probably ARDS, you can actually improve survivorship. So I'm not saying we should go giving people this. It's too early. I know they've been doing it in some hospitals, but certainly if we can boost up our own levels naturally, I think it's worth doing.
Yeah, absolutely. And Dr. Pedre, what about all the symptoms that people present with? I mean, we used to have it down to a couple of symptoms, but now that symptom list has seemed to have really grown. Can you talk about a little bit about patient presentation?
Yeah, I mean, it goes back to like we were talking about, the ACE2 receptor. And we know that, I'm just going to use my picture a little bit because I love drawing pictures. So I'm going to take you to my board. So we know there are ACE2 receptors in the airways, right? And in the lungs, we've got ACE2 receptors. But it also happens to be that we have ACE2 receptors in the intestines. And these are probably the two biggest representations where the virus comes in. And the other place where we find ACE2 receptors is on fat cells, and they might actually be upregulated in fat cells. And that's one question why maybe obesity could be a higher risk factor. They take on more virus, produce more viral particles. But we also know there are ACE receptors in the circulation as well, in the smooth muscle inside the vessels. So basically, there's smooth muscle and vessels in every organ in the body. So that's a reason that we're seeing patients develop kidney failure. And also we're seeing patients with what they call COVID toe or COVID finger, where it's getting inflamed because it's getting poor circulation. And I just wanted to mention one other thing in this picture. This is a cell with an ACE2 receptor. The ACE2 receptor is basically like the lock, but you need an enzyme that's called TMPRSS, and that's like the key that opens the lock and then lets the virus into the cell, where it hijacks your cellular machinery and it starts to replicate. And so there could be a reason also why some people are more susceptible than others. And it has to do with the genetics around TMPRSS, that key that lets the virus into the cells. And there might be different expression between men and women because it's an X-linked gene. And as we know, men only have one X chromosome, whereas women have two X chromosomes. And it also, what's really interesting is that it's possibly another avenue of treatment for a future epidemic, because we have a medication that's been developed in Japan that actually blocks that enzyme and then can block the entry of the virus into cells.
We're really learning so much all the time. And Dr. Littleton, as we are starting to come out of these, emerging from these shutdown orders, what do we need to do to protect ourselves? Because, I mean, what advice do you have for us as we step out of self-isolation?
Yeah, the greatest advice, and it goes back to the basics, and everyone's heard this time and time again, it's always wash your hands. And people are probably tired of hearing that, but I see people all the time who will wear gloves, and I've seen people with their gloved hands touch their face, touch their ear. And so we have to continually get the message across. The virus is spread by people touching their eyes, their nose, their mouth. It's so important that people remember to do that. I think as we go into this new normal, there's going to be social distancing practices that carry over for a while. People will need to remember to keep their distancing. If they're sick, that's a great time to wear a mask. They want to make sure that they're practicing great, proper hygiene. They want to make sure that if they see anyone in a restaurant making food for them, using gloves, and they're not changing their gloves, ask them to change their gloves. I was having a conversation with a doctor today about this very thing. If you want your doctor to change their gloves between each room they go into, you should also expect that of your server as well. We have to be careful. We have to be respectful. People want to make sure that they carry good practices as far as being compliant with their medications. If you have diabetes, if you have hypertension, if you have congestive heart failure, if you have COPD, stay compliant with your medications. Talk with your doctor. Make sure that you're staying healthy. Don't get behind. If you need refills, get them as soon as possible. These are basic things people can do to make sure that they're protected when the stay-at-home mandate is open. Listen, if people don't do anything else, if you do those things, people will be more safer. They will reduce the risk of getting infection, and they'll protect their loved ones at the same time.
I love that. And so to kind of tag on to that, Dr. Moorcroft, you talk a lot about sleep, and I think we really need to have a little bit of a discussion about that as we are opening things up, and really let people know that when you think about sleep, you think, what an oversimplification is that? It's just sleep. We all know, get a good night's sleep. But you talk really about how it's so important now with this virus, and you speak about melatonin and its effects and how it can be helpful.
Yeah, sleep is ultra critical. And I think for a long time, we kind of thought it, but we didn't really know why. I think there's so much research telling us why now, which includes, something like 70 to 90% of our brain detoxification happens while we're in deep, slow wave sleep. We consolidate memories in sleep, and certainly healing and immune optimization occurred, during sleep. And melatonin is our primary sort of sleep hormone. So most of us think about melatonin as a supplement we take at night, but really melatonin is a hormone that our body begins to produce in the morning when it's exposed to natural light. So one of the things I tell people, if they want to get to sleep, they actually should get up in the morning and go outside and get some sunshine. Fresh air doesn't hurt either. But so that natural light triggers this melatonin. And then at night, when the lights get darker and we turn off the lights, that's a trigger for our body to let the melatonin out. And that allows us to sleep more deeply. But as a hormone, it does a lot more too. It reduces free radicals. It can lower the production of pro-inflammatory cytokines. And when we talk specifically about COVID-19, the virus that causes this can actually trigger these NLRP3 inflammasomes, which is just a fancy way of, these are things that trigger inflammation. So the virus will trigger inflammation. And melatonin has actually been shown to block or inhibit those inflammasomes so that we can decrease some of the inflammatory damage from this. So, you know, it's a really potent antioxidant as well. So get up in the morning, get some sunshine to get the melatonin going, wear some blue blockers if you have to be in front of the light at night, and then really get darkness to really help you sleep. And one other kind of quick tip for everyone, if they're having a hard time sleeping, is to turn off your Wi-Fi at night, because it's just a little bit of an extra irritant. And we can see that there's a thing called rouleau bodies, which are stacking of red blood cells that we see in rheumatoid arthritis, infections, and some inflammatory conditions. And if we actually minimize our Wi-Fi exposure, that can make a big difference in that. And for anybody living in the city, it's about proximity. So even if your next door neighbor has it on, if it's in your house and closer to you, still go ahead and turn that off. And it's as simple as putting it on a timer. But that can help you not only with sleep in general, but optimizing melatonin and hopefully decreasing inflammation if you're exposed to the virus.
That's great.
Kellyann, I'd like to bring the gut into the conversation because it turns out that the gut
What would you
produces
expect from the gut doctor? What would you expect? A happy gut.
I gotta talk gut. 100 times more melatonin is produced in the gut than is produced in our brain. And normally we associate melatonin as a brain hormone, but it's more of it is produced in the gut, and we can actually get it from certain foods like red radishes. Japanese radishes have melatonin, and they help promote melatonin production, as well as tryptophan, which is found in turkey. So maybe that's why you feel sleepy after a turkey dinner. But that's an important thing to remember because, you know, I always talk about the gut as the gateway to the immune system. And if you fix your gut, then you also are able to produce more melatonin. And for all the benefits that Dr. Moorcroft just talked about.
Yeah, and Dr. Cook, you talk about something that I would guess a lot of people haven't heard of, which is ozone and the use of ozone. So please explain to everyone what ozone is, how you administer it, and if they are interested in doing this, is this something that they can find easily, or is it more difficult to tap into?
So I was happy to see Tom on the call today, just because I know I've got another Lyme doctor who knows about ozone. So
I know a lot about ozone. Ozone has been unbelievable in the treatment for me and for many various things, but I'm a big believer.
So ozone's been around for over 100 years, and there are ozone generators that take an oxygen gas, and they run an oxygen gas over electricity, and it creates different oxygen species, including O3. And so ozone is actually a mixture of O3 and O2 mostly. And what it does is it facilitates oxidation reduction reactions in the body. And when we take and pull some blood out of the body and mix it with ozone and then put it back in, we're putting oxygen and we're putting ozone in. And once that ozone goes into the blood, it facilitates oxidation reduction reactions. In the case of a virus has no buffering capacity, so it gets oxidized and neutralized by ozone. Same thing with bacteria, which is why people who take care of a lot of patients with Lyme or chronic viral problems, we use this strategy to facilitate treating the infection. our blood has an enormous buffering capacity. So our cells have no problem handling the amount of ozone that we put in. And so you can mix ozone with water and drink it. You can take and make an ozone gas and give yourself an enema, so rectal ozone. You can mix blood with ozone. So those are the three main ways that people will do it. You can insufflate your ears. And I've been doing ozone for patients with complex illness and Lyme for over a decade, and have a lot of experience taking care of very sick patients. And what we were talking about, where the virus can come in and take over the epithelium and then create a whole bunch of virus in the lung, the same thing is happening in the kidney and the heart. And then when that happens, it creates stasis and plaque rupture and things. And so people will present almost like they're having a heart attack. It's leading to kidney failure. But my theory is that what happens is when we put the ozone in,
Yes.
I have something that is actually antiviral that's floating around that can go to the heart or the kidney. It can cross the blood-brain barrier. And so it's an antiviral, and it's part of an overlying, it's part of a functional medicine strategy, because the only way you're going to treat this is with a thoughtful, well-rounded functional medicine approach that addresses the gut, addresses a multimodal approach. And what I'm doing now is I'm raising money. We're putting our process through an IRB approved protocol.
Yeah.
And then I teach for Dr. Schellenberger, and I've been teaching for him for quite some time I'm teaching other people how to do ozone. And so what I'm going to do is I'm trying to get connected to an extremely underserved area. So we've been reaching out for the last couple of weeks to the Navajo Nation. And I had some people talk to the tribal elders there. But if I can find a area that is underserved and I can find practitioners, I'll train them for free. And then we're going to try to go out. And what my goal is to treat 100 people who look like they need to be intubated, and then see what happens. And I think my hypothesis is that combined with everything else that we do, which is almost all off-label, exosomes and other things, but that I think it may be a game changer. And I've treated in retrospect over the last 2 months what sounds like 8 to 10 people who sounds like they have positive COVID, including my parents. And everyone's done very, very well. So
Yes.
we're
Cutting edge.
super optimistic about it.
It's cutting edge, and way to go on that. And I know Dr. Moorcroft is just percolating. It sounds like you want to say something. I also have a question for Dr. Littleton. I'm going to shoot to you. But Dr. Moorcroft, go ahead and say what's on your mind.
Yeah, just a quick kind of personal thing. Early February, I was traveling and I came down with what now sounds like COVID-19. And right now I'm waiting for my antibody testing, But I happened to be in Arizona near a friend's office. I went in, I got some IVs, including high dose vitamin C, as well as ozone. And for the next 24 to 36 hours, it was horrible. But after that, it broke like this. And it was, from what I'm hearing, I mean, it really sounds like that was it. But it was amazing how quickly I was able to ride through it. I still had the fever afterwards, but it lasted, 12 hours, the fever. And then it was pretty amazing. So I think that the ozone treatment and the IV vitamin C made a lot of difference. And hopefully by the end of the week, I'll be able to tell you if it really was COVID-19 or not, if the test happens to be accurate. So.
Mm-hmm. And so, Dr. Littleton, we hear a lot about sunlight, and that the sunlight just apparently, from what we're reading and hearing, is poof. It just dissolves the virus. So what does that mean? Does that mean that when the weather changes, or how does that affect us?
So what we're looking at here is, first of all, a lot of the evidence right now is anecdotal. So what we're looking at here is that we know that the virus likes temperate weather. So, that's why people are wondering, will we see a second spike in the fall? And I think we probably will. And that's kind of coinciding with flu season. So we think that in the summer, this will die down a little bit, then pop its head up again back in the fall, winter, and then kind of in spring again. And so what we want to do is we want to look at that, prepare for the fall. Now, we're not going to have a vaccine during that time. You know, a vaccine might not arrive until 2021, the beginning of 2021. So what we have to do is take some of the lessons from social distancing and apply that and prepare. Not just that, we have to make sure we ramp up production of PPE equipment, because that's been an issue. You know, yesterday here in Florida, the Florida Medical Association sent a letter to Governor DeSantis about slowly opening the doors for surgical centers for elective surgeries. And we're looking at doing that in incidence places that are lower stable. See, the issue here, initially, the governor made a mandate to hold elective surgeries because of the concern of PPE equipment. That was how it originally was started. So we have to ramp these things up. We weren't prepared for this, but when it comes around in the fall, we should be prepared. And I think we're going to be more consistent in terms of taking care of both elective and non-elective surgeries.
Wonderful. And Dr. Pedre, why, this is going to be the last technical question, and then I want to get to kind of therapies. I want to give some take home for everyone, because we're getting down in time, and I want to keep this strictly to an hour so we can use this on all platforms. Dr. Pedre, why is this hitting a significantly more men than women? Why is that happening?
You know what, I think we're going to have to let's just say we're going to have to do a final analysis on that once all the numbers are in. In China, it seemed like it was hitting more men than women. And the question was it related to smoking? Because it seemed like there's an upregulation of ACE2 receptors when you smoke or you're exposed to pollution. So could it be that? Could it be that there's higher rates of obesity in men than women? But when they looked at those affected in Italy, it was more equal between men and women. So right now we're just working on theories, and I think we need to see the final numbers. If you look in the US, the rates of smoking in men are at least 3 times that of women. And the drinking also, men tend to drink alcohol more likely than women. So they're doing an activity that reduces your immune system, which we haven't really talked about, but the whole other part of this, you know, is not so much about the big scary virus as it is, what are you doing to fortify your own immune system so your body can ride this wave? Because inevitably, the majority of us are going to get exposed to this at one point or another. And so washing hands, yeah, all that is important. I did an interview with Dr. Maya Shetreat earlier today, and she said something that I thought was so poignant. I want to share it here. And I think it's kind of it's an interesting contradiction from our social isolation, that our immune system is actually very social. The way the immune system works all along the gut lining is checking out what's coming in, what's friend and what's foe, and they're kind of interacting. They're like, yeah, I know you, you're a good bacteria. We're not gonna bother with you, and we're gonna kind of stay chill. And then it sees that cinnamon bun come in, or, you know, that surge of sugar, and it's like, you know, this is not self, this is an enemy. So our immune system, contrary to all our social isolation, is quite a social conglomerate of cells.
It's so interesting. Yes, the cells communicate, that they truly do. This is,
and you need them. You actually need them and want them to be social in order to work at their best.
absolutely. And there's many ways to accomplish that. So let's talk a little bit about that. So I want to give everyone, we've got about 9 minutes left, folks. So panelists, would you give everyone a take-home message that you can, by either inspiring them or telling them a protocol that would be very suitable for them moving forward into these next months, these challenging times? Let's start with you, Dr. Moorcroft. So I want you to really just, understand that, to the people with whom you're speaking, either give them a word of inspiration or tell them a protocol that is near and dear to your heart that can make a difference in their lives.
Yeah, I love what Dr. Pedre said. It is so important that you are in charge of your health. And that's, like, to me, the most invigorating thing about this is this is a time where I get to be reconnected with the fact that I actually have a lot of control over my immune system, over my nervous system. So for me, really big ones are sleep 8 to 9 hours a night if you're an adult, more if you're a kid. Get up in the morning and get some fresh air to get the vitamin D going, the melatonin. Eat, fresh air. We know from the Spanish flu pandemic, osteopathic physicians asked people to breathe and get some fresh air and do some movement, and their mortality rate was 3 times less than everybody else's.
Mm-hmm.
And it's as simple as fresh air and moving around, get the lymphatic fluid going. And then, I really think it's obviously with what we're all talking about, diet is super important. So have some fun with it. But one of the most important things is to take this time to chill out and find some meditative practice, reading, drawing, painting, whatever it is that inspires you and brings gratitude and love into your heart, because that is one of the most immune boosting things you can possibly do. It gets you very parasympathetic and really kicks up your immune system. If I have to, the things that I'm taking that help me, I love Transfer Factor Multi-Immune by Research Nutritionals because I get some mushrooms and some immune supporters along with my zinc and selenium. And I really like those zinc, selenium, quercetin, and vitamin D in my sort of general daily supplement packet. There's a lot of other details you can throw in there, but for me, it's more about food and movement than it is my supplements. But because of everything that's going on, I think rounding it out's not a bad idea either.
So the one that you mentioned, just so Stacy can put it in the chat, what was the one that you had mentioned that was a little wordy?
Oh yeah, Transfer Factor Multi-Immune by Research Nutritionals. And I know I sent that over to her.
Okay, a Transfer Factor. Awesome. Thank you so much. I really appreciate it, Dr. Moorcroft. They're great words of wisdom. Dr. Cook, can you please express some words of wisdom to the audience?
I will second sort of everything that Tom said, and in general what everybody's saying, because I generally agree with everybody. What I would suggest is at this moment, if you don't have any symptoms, take advantage to find somebody who does IV therapy, who's close to you. And then if you're close to Dr. Pedre, if you're close to Dr. Moorcroft, go find them and then get a vitamin C IV and our protocol is to do vitamin C, intravenous lysine, and then intravenous glutathione, and then intravenous ozone. And so I would try some of those things and get an experience. Go in and go see them and do a low dose IV, something that might just be stimulating the immune system, and get a sense of how your body responds to that. And then now you're kind of biohacking and starting to do something. And then do that a couple times. And
what if someone, Dr. Cook, excuse me, what if someone has limited funds or they're new to all of this? If you just give them a starting point, just give them somewhere they can jump out of the gate.
So as a starting point, go get a Myers cocktail and a glutathione push afterwards. Mm-hmm. That's a great, simple, should be $200 to $400, and just give it a try and see how you respond.
Okay, thank you. I think that's great advice. I love Myers drips. Love them. Dr. Littleton, can you please give some words of expression to everyone?
Absolutely. First thing I want to say is, listen, don't fear, think. There's a lot of fear and panic out there, but there's some commonsensical things that we can do. I like my acronym that I wrote in my first book, MEDS, move, eat, drink, sleep. And everyone on the panel said some wonderful things, and I agree with them. If we remember that we must exercise, we have to keep our daily habits. Eat organic, eat healthy, avoid sugar, okay? Eat sensible, eat smart, eat for energy, drink fluids, good water. We all know that, but we have to practice it, just like we have to practice washing our hands. And sleep, and I've heard someone mention about sleep. Yes, sleep. Make sure, this is a great time where people are at home, stay-at-home mandate. Make sure you're getting your 7 to 9 hours of sleep. Allow your immune system to fight for you. If we do these basic things, even for a low-income person to a high-income person, we can lower our risk of infection, and we can stay healthy and help our loved ones.
Beautifully said. Amen to that. Dr. Pedre.
Oh, geez. Ditto to everything that all the panelists have said. Very intelligent points. I want to kind of use the words of one of my patients. She said, "This is a wake-up call." And what I've seen and really inspired me yesterday, I spoke to one of my patients and she said, I've been watching the live interviews and I know that obesity is one of the risk factors. So she put everything that I've taught her in the past into effect. I teach my patients the gut is the foundation to your health. And she took out all the junk food out of her diet, took the sugar out. She's lost 14 pounds, feels great, no sugar cravings. And I think it's so important, to remember that. And I want to bring in what I interviewed the founder of Modern Om, who's doing something called the cushion crawl, which is really cool. They've been doing a daily meditation. Now they're on their 29th or 30th day in a row with meditation teachers from everywhere. And, you can either look at this, be in shock of what's happening or think this is one giant deep breath. Mm-hmm. We're taking a pause, and what an opportunity to develop new habits, to take those deep breaths, to activate that parasympathetic nervous system, to be out of that fight or flight response, which puts your immune system on edge. So, I'm just going to end with telling people, take deep breaths.
I love it. Oh, I love it. So we are down to 2 minutes. Very quickly, everyone, if you would. Dr. Cook, where can everyone find you?
BioReset.com and BioResetPodcast.com.
BioReset. Dr. Moorcroft.
They can find me at originsofhealth.com.
Origins of Health. Dr. Littleton.
Very simple. JasonMD.com.
JasonMD.com. Dr. Pedre.
Find me at happygutlife.com. Go to my Facebook, Dr. Vincent Pedre, or I'm always on Instagram at Dr. Pedre and doing lives. And I know I'll be back here with you, Kellyann.
Yes, so you'll see these fine doctors once again. Please join us again tomorrow night where I take a deep dive with Dr. Ann Shippey, who has a very interesting story to tell, as well as lots of information. Thank you to the panelists. I appreciate your contribution. We look forward to seeing more of your work, your amazing work. We're signing off here with all the grace and all the love. Until next time. Bye-bye, everyone.
Thanks so much.
Thank you, Kellyann.
Bye-bye.
Nice seeing everyone.
Nice to